Do you foresee it in the future, there becoming a better test? For instance, like with a spinal cord injury, I'm assuming for me, my PSA might be not in whatever the normal range is. Would a PSA test on someone with a spinal cord injury be different than the average population? And so it wouldn't give either a false indication, or because there's enough spinal cord injury patients, say, or other type of injuries, that you now have a better range to look at for those with more of a complex health problem?
That is such a good question. That is such an excellent question. Because yeah, we definitely take it into consideration, but we still have to do it, right? Because based on your health characteristics, I believe that you're going to live more than 10 years. So that merits an examination of your prostate. Now, your PSA might, in some people's spinal cord injuries, might not be fine, particularly if you're in the setting of a prostatitis or a bladder infection, because that's going to drive up your numbers. So when we do a PSA, you have to really interpret it in the context of the patient that you're treating. So if I had a high number, I would not get excited about it. I would say, like, Stephen, listen, I don't know what you're doing at the time, but your number's higher than it was a year ago. So we're going to wait 6 weeks and repeat the number. And it usually goes down. 50% of the time in all people, it goes down. But particularly in somebody with a spinal cord injury who's catheterizing or has different reasons why their number could be high, we're not going to get excited about one number. We're going to watch it and reevaluate. And if it's still high, then we're going to like test further because we want to make sure that we're not missing something. But most of the time, if you can use a PSA in a spinal cord injury patient just like you can in everybody else.
Yeah, I think that's the important